this ever happened to you that you are brushing and then you suddenly see some bleeding gums and then you're scared if you're brushing too hard? That's exactly what happened to this young patient of mine. She was brushing and she saw bleeding from her front of her gums, and then she started using a soft toothbrush and shied away from brushing, and this is the end result. As you can see, all her gums are looking really red and inflamed. Most of her teeth in the front are completely covered in plaque. If you look at her back teeth, actually at the bottom, the gums look healthy there because she does not see the bleeding or anything, and she's brushing there well. But because she's shying away from brushing, she's not able to clean these teeth properly, which collects the plaque, which makes, so plaque staying on near the gum for about 3 to 5 days can make the gums go red and inflamed like it is on this. Gums can come away from the teeth and then it will bleed. So healthy gums do not bleed. You need a medium toothbrush and you need to brush efficiently wherever there is bleeding to get rid of the plaque, to stop the bleeding.